I set out to develop a psychiatric clinic to treat patients who are Hispanic and Spanish speaking, to provide an aspect of cultural sensitivity to their psychiatric care given my Hispanic background and fluency in Spanish. From my experience, this patient population has barriers to overcome when accessing mental health care. The first being that they need to recognize their symptoms as part of a mental illness and accept the possibility of needing to take medication. If they seek out a mental health provider, they may have difficulty in accessing a Spanish-speaking psychiatrist and/or afford to see one. With this Spanish language clinic, I was targeting the language barrier, and by partnering with the financial assistance program in the community, I hope to reduce the cost when seeing me at our community clinic where we relocated. By speaking Spanish and with the general knowledge of the Hispanic culture, I could build rapport with the patient and hope the patient would be willing to adhere to the recommended treatment to include medication. I soon learned that there should be a big emphasis on educating the patient on mental illness and its treatment with medication, as there continues to be a stigma regarding mental illness in this population, along with misconceptions regarding psychiatric care. Also, while I spoke the patient's primary language, I still needed to recognize that each patient is unique in terms of their understanding of their symptoms, and to avoid the pitfall of mislabeling their symptoms as somatization. As to forming the clinic itself, what lacked was the infrastructure of having Spanish-speaking staff and psychiatric providers other than myself, along with signage and forms in Spanish, which limited communication between the staff and patients. And this led me to attempting to take on the role of performing all pre- and post-appointment tasks for these appointments. If this infrastructure is in place, the rest should take care of itself. As for costs, these patients could not be scheduled in our usual outpatient psychiatric clinic due to costs, as many could not afford the intake cost or qualify for the hospital's assistance program known as charity care, as many of these patients do not have legal status in this country and therefore do not qualify. By moving to our community psychiatric clinic, it helped to work on seeing these patients at a place whose aim is to treat underserved populations. By working with the community assistance program, these patients could be qualified to be seen at our community psychiatric program at little to no cost, but ultimately many were not seen because the eligibility criteria was too restrictive. Finally, I would propose more clinics like these to form, as I saw a big need for psychiatric care for such patients. I saw patients from various countries of origin suffering from mood and psychotic disorders, along with a history of substance use, but suspect more psychiatric conditions if more patients can be seen.